Okay. Hi, everyone. Hello, guys. Good afternoon, good evening. In fact, it's good morning from my side. I'm taking this session all the way from the opposite part of the world. I'm sitting in Canada, Calgary right now, and it's morning 3:30 a.m. here. So, yeah. So, we are exactly in the opposite time zone. Good to have you all here. Okay. Hi, hi everyone, guys. I can see you in the chat. So just quick me, let me know if the audio and video is fine, so that we can proceed with this discussion video. Could you just very quickly tell me in the group that if the audio and video is fine, and we can proceed with the session. Okay. So okay, perfect. Thank you, Harjeet. So guys, the as you know that this is the round two revision which is going on for this for the FMG upcoming July exam, and it's a great attempt. This ATP, this basically the ATP which is to provide energy, and that I hope that these sessions are providing energy to you. If I'm not wrong, the session before me was the physiology session, and I saw that session was taken in multiple part, and I'm sure that was quite effective in your quick revision of the major topics. Okay, so let me tell you that how we're going to proceed about it. I know that you people, yeah, obviously exam is in the July, so आप लोगों ने obviously you must have read it from different sources, and you must be having your core tool to prepare the subject from. Maybe you read anatomy from the different sources, maybe from DBMCI or maybe from other source. That doesn't matter. See, the point is that what is the whole crux of taking this session is obviously 5-6 hours maybe we cannot just like cover up like everything in the anatomy. No, that's not the case. And I just do not want to go through the PYQs only. PYQs here, everyone is reading previous year questions. They're given in the question bank. So it's not that if I just know the answer to the PYQs, I will be able to attempt those questions in the exam here. And I hope you agree with me. So what I've done is that I have basically collected all the last 5-year questions of the FMG examination, both exam which occurs in a year. And what I've done is I've basically kind of collected those questions, organized those questions according to the like head and neck, neuroanatomy, embryology separately. And let's try to do one thing. Let's try to discuss around those topics, the questions which are being asked here. Though you have a MCQ discussion session coming up after mine, there is after me, but in that part you will be core discussing the question. My job is to tell you a little more about around that topic, because we all know that whether it is FMG examination or it is NEET PG or it is INI-CET, the previous year questions and topic holds the most importance. Right? The question which will be asked will definitely be based on the topics which were asked earlier. And this is not only true only for the FMG exam, it is true for any exam in fact. I mean, previous year questions, we all know how important they are. But the mistake which people commit is that they just rely on those PYQs in their answers. I'm not. I mean, I'm sure that many of you must have read the topics from different sources, and then you just read PYQs. And if you don't know that if there is a little tweak or the twist in the language of the question, how to attempt that, then it is going to not going to our hard work will go into vain, because we don't know that still discussing that topic and we're still not able to answer it. So without a further ado, a voice break in between. Well, I don't think that should be the case, but if it is, yeah, take care. Please manage. As I say, I'm taking this lecture from exactly from the far off. So if there is any technical problem from my side, I'll try to resolve it. So guys, let me just. I know. Some Samiksha. Yeah. Yeah. I know that anatomy is definitely would have been the trouble for many of you. So let me try to help from my side whatever I can in this limited time. But I hope that I'll make this session worth your while. So मैंने क्या decide किया guys? I'm gonna discuss this session in this entire thing in 3 sessions. So पहले 1.5 hour, 2 hours we'll discuss about the couple of topics. Like I'll start with the head and neck and neuroanatomy. Then I will go to the embryology part, limb, upper limb, then lower limb and abdomen and the general part. Like that's how I'm going to proceed into this. Again, I'm saying this session is not to cover up everything. The session is mainly focused on what are the questions asked in the recent time, because PYQs are important. Hey, they are definitely going to ask these questions again. but again, what other things they can ask you from the same area, and how you will be able to answer those questions, right? And as we all know that image-based questions are in the trend, so I'll be showing a lot of images in between. Well, regarding the annotated PDF and all, please don't worry about it. Whatever I'll write, whatever I'll show you here, the entire annotated PDF will be made available to each and every one of you. The people who are DBMCI student, they will obviously get through the Telegram channel as well. And this PDF will be uploaded on a link, on a Google Drive link or something, and that link will be posted in the video. So don't worry about that. Just keep that aside, that okay, the PDF and what will you do. You don't have to take a snapshot or anything. Just I want you to just sit down and listen, and let's go with it here. Okay. Chalo guys, let's get started. Okay. So first of all, what I've done is this is completely based on the some PYQs only. As you can see, there are some number of topics which are written in front of you, and then again I have written these topics for the like you can see for the neuroanatomy. Then again you will see for the embryology, you will see for the upper limb and the lower limb, and these are the questions which are asked in the recent time, right? So I will try to plan my discussion around these topics here. So इससे पहले हम start करें, just let's have a quick outlook that what are the things which are being asked in the core anatomy part in the last 5 years here. Again, I will try to respect the part that जो चीजें ENT और ऑफ्था के अंदर cover हो जाएंगी, will not go into that because anyways that part will cover there. I'll be talking mainly on the core anatomy part here rather than just invading that territory. Now, I'm sure that you people must have seen this question over and over again, that which of the following is the safety muscle of the tongue. So question about the safety muscle of tongue, safety muscle of larynx, that we need to keep in mind that what are the safety muscle. And they have asked this question this way, and they even asked the same genioglossus muscle in the image-based question also. Because this is one of the proof. The question number 1 and 2, these are two separate questions asked in the FMGE examination. Once they've asked the safety muscle, which is genioglossus, and they asked identify the genioglossus muscle in the picture. That tells you that the same previous year question is asked in a different way. So this is what we have to do with the topic. Like if a question is asked once, if an image is given for that, or if they tweak the language of question, तो मैं कैसे उसको identify करूँगा? That is what I will try to focus on in this session about here. Yeah, I know you all know the answer, guys. I'm pretty sure that you all know the answer to these questions here. But as I said, I will be going a little further in this. Then the question is about the Buccinator muscle is pierced by. Now this question is important whether it's NEET, PG or INICT, FMGE exam. Everywhere this question is important, the Buccinator muscle and the structures piercing Buccinator. One of the topic, muscles of mastication, this never gets old. In fact, in the head and neck questions, in the core anatomy head and neck questions, this is the top of the food chain question. Muscle of mastication is something which is like they're one of the favorite question to ask. Image-based question on the muscle of mastication. I mean, out of all the topic written in front of you, if I have to tell you one topic that जो आपको छोड़ना ही नहीं है, they definitely have to have good command on is muscle of mastication, like without any doubt. And in the recently conducted INICT also there was a question on this. The question which is again very frequently asked is about the Tyrion and the relations of Tyrion. So middle meningeal artery is asked separately as a question, and Tyrion is also asked separately as a question in the exam. They have asked the question about the ganglion supplying the lacrimal gland. Now, if the question is asked on the ganglion supplying the lacrimal gland, it's our responsibility. We should know the ganglion supplying all the glands. Parotid ho, submandibular ho, whatever gland is that, I should know about this ganglion and the gland. So we're not going to cover the lacrimal gland. We'll look at the other part also. Then you can see the question about the Bell's palsy, about the facial nucleus. So upper motor neuron and the lower motor neuron lesions of the facial nerve, how the presentation will be. Image-based question आएगा तो कैसे करेंगे उसको, and what are the different lesions and different outcomes that you'll see. Again, we'll talk about that. I have also noticed the question asked on the submandibular gland surgeries. You can see a couple of questions on the submandibular gland. Now, दो major nerves वहाँ पर lingual nerve और hypoglossal nerve are present there. If they will get injured, what will be the consequences? That again we have to talk about that. Laryngeal nerve supply, although this will be covered in the ENT also, but let me tell you that laryngeal nerve supply also. And again, this is a question which is a little more of an osteology based question about the mandible, inferior alveolar nerve and lingual nerve which are running close to the third molar. Questions of the dural venous sinus with a special emphasis on the cavernous sinus and its relations. So guys, if you again look at it, the topic may look haphazard, suddenly from the muscle to the ganglion to something, that doesn't matter. Our job is to look at whatever these topics that you're looking at on the screen right now, they are all previous year question, last 5 year only, and let's plan our discussion around all of them. Okay, let's go. So The first question here is about the safety muscle. Now you all already have given me the right answer, guys. Safety muscle of tongue is genioglossus. I'll try to label this for you. So as we know about the safety muscle, now first of all, I believe that if the question is asked on the safety muscle, they can ask you the safety muscle of the tongue. The safety muscle of the tongue is basically the muscle which prevents the tongue from falling back. We know the tongue is held by the muscle which is not allowing the tongue to fall back, or why don't we deglute our own tongue? That is because of a muscle coming from the genial tubercle of mandible, and that muscle, you all rightly said, that is genioglossus. The muscle is genioglossus, and that's the safety muscle. I'll show you what's the safety, where the muscle is. And they can even ask you the question about the safety muscle of larynx. Although I'm going a little out of the topic, larynx safety muscle is also there, because if the question is on the safety muscle, well, you never know. Safety muscle of larynx is the muscle which keeps the airway open. And that muscle, the only muscle which is an abductor of the vocal cord, is the posterior cricoarytenoid. The muscle is posterior cricoarytenoid, and the reason posterior cricoarytenoid is the safety muscle of larynx because it is the only abductor of vocal cord. It is the only abductor of vocal cord. It is the only muscle which keeps the the airway patent. So it is a safety muscle of the larynx supplied by recurrent laryngeal nerve, right? Most of the muscles are supplied by the recurrent laryngeal nerve in the larynx, including this posterior cricoarytenoid. Yeah, exactly. So now the question is, when they ask this, the safety muscle of the tongue, which is already asked in the exam, genioglossus, now just in the year later, they ask the same thing, but on the image. So now what is the safety muscle of the tongue and how to identify other muscle of the tongue? That is you have to see. मुझे खाली genioglossus नहीं पता होना चाहिए. I should be knowing other muscle of the tongue and what their function is and how to identify them in the picture. Okay. So what you're looking at right now on the screen, guys, this is the, that's a picture which is showing you the tongue muscle. The speciality of the tongue muscle is they're working in all different directions. Like you can see this muscle of the tongue which is going to pull it upward, and that muscle is palatoglossus. It's a muscle that is a palatoglossus. You can see muscle is coming from palate and it is pulling the tongue upward. That is palatoglossus for elevation of tongue. Then you can see the muscle which is pulling the tongue backward coming from the styloid process, and that is styloglossus. Then look at this muscle which is coming from hyoid bone, which is for the depression of the tongue, and because it is coming from the hyoid bone, so the muscle is the hyoglossus. And let's the most important muscle that we have to talk about, let me highlight this muscle for you guys. This muscle, look at this big fan shaped muscle which is actually coming from the genial tubercles of the mandible, and the job of this muscle is to protrude the tongue. It takes the tongue forward, and that muscle is genioglossus. The muscle is genioglossus, coming from the genial tubercle. यहाँ mandible पीछे tubercles होते हैं, वो genial tubercle बोलते हैं. So it is coming from the genial tubercle, so we call it a genioglossus muscle. And yes, that's our answer, that genioglossus is the safety muscle of the tongue. Now they might even ask you the same image, क्योंकि already पूछ चुके genioglossus muscle in the image. Now they might again give you this picture and ask you that which of the muscle of the tongue, which of these four muscle is having a different nerve supply. देखो again try to look at these images and anticipate कि नया question क्या बन सकता है यहाँ से. What could be a new question they can ask you here? Well, the answer is obviously the palatoglossus. Palatoglossus is a muscle of palate also, right? So it is a muscle of being of muscle of palate as well. So it is supplied by vago-accessory complex. Vago-accessory complex. It's a vagus nerve and accessory nerve together which are supplying the palatoglossus muscle. Rest of the tongue muscles are all supplied by the hypoglossal nerve. It's hypoglossal, even genioglossus is by hypoglossal nerve. Only palatoglossus muscle is supplied by vago-accessory complex. देखो, this is what I feel when you look at this question. Genioglossus की at least मुझे इतना पता होना चाहिए, so that if a question is repeated to me, I can identify the muscle, I can name the muscle, I can identify other muscles of the tongue, and I should know the nerve supply along with their action. You can see the arrow, you can make out that what is the action of those muscles, right? So this is about a little about this safety muscle of the tongue. चलो वापस आते हैं. So then we have a question which is asked on the, like we talked about this safety muscle, we talked about this genioglossus. Now let's talk about the buccinator muscle and the structures piercing it here. Now guys, when I say buccinator muscle, what makes the buccinator muscle even more important is the parotid duct running on it. So it's not just about knowing the structures piercing Buccinator. It is also important that simultaneously I'll tell you something about the parotid duct also, the Stenson's duct or so-called parotid duct as well. So let's do that. So Buccinator is a special muscle because obviously it's a muscle of facial expression. Being a muscle of facial expression, it is supplied by the facial nerve, but it is also called as an accessory muscle of mastication also. It helps in mastication. Obviously, mastication muscle, we all know lateral pterygoid, medial pterygoid. But while mastication, guys, when you clean the food from vestibule, when your tongue will clean the food from vestibule, like when you're eating, you do like this. This cleaning of food from the vestibule, from the cheek area, is only possible when you inflate your cheek, and that is done by what muscle? Buccinator. So it is definitely the muscle of facial expression, but it is also called as an accessory muscle of mastication. Accessory muscle of mastication. What makes the Buccinator muscle important? See, the structures piercing it. The structures piercing the Buccinator, number one is the parotid duct or so-called Stenson's duct. Parotid duct or Stenson's duct, which is piercing it. Number two, it is pierced by the buccal branch of mandibular nerve. Now, buccal branch of mandibular nerve, guys, it's a sensory nerve. Please don't confuse. There are two buccal nerves that we have. One is a buccal branch of mandibular nerve, which is a sensory nerve. This nerve is sensory. And there is a buccal branch of facial nerve, which is a motor nerve. Now, buccal branch of facial nerve is the one which supplies Buccinator, not piercing. Piercing with the structure should enter from one side and should come out from the other side here. Now, it is the parotid duct 1. We have buccal branch of mandibular nerve, that is a sensory nerve, which is piercing Buccinator but doesn't supply it. Now, it is not following the Hilton's law. According to the law, the nerve which is piercing the muscle should supply the muscle also. But yahan nahi kar raha hai. It's a sensory nerve. How can it supply a muscle? So buccal branch of mandibular nerve is piercing Buccinator but supply nahi karta usko. It is not supplying it. Number 3, there are some mucus glands. You can call them mucus glands of buccopharyngeal fascia. These mucus glands are the one which are also piercing Buccinator. So guys, these are 3 major structures which are piercing Buccinator. And remember, whatever is given apart from this, like if I correctly recall the option, label branch of facial artery, buccal branch of facial nerve, remember, it is not supplying it. Buccal branch of facial nerve is not piercing it. I'm sorry. It is supplying Buccinator, but it is not piercing Buccinator through and through. So these are 3 structures which you have to go with. Another reason that Buccinator is an important question to ask, that is basically for the parotid duct here. Now, I'm taking like from the Buccinator muscle to the parotid duct, but because dono topic related hai, so I should be telling you here itself. How does this Buccinator muscle pierce by the parotid duct, and what are the other structures pierced by parotid duct? Let's talk about that as well. Now look guys, if this is the, if it's a cross section of the mandible, ramus of mandible, we will be discussing it in a while. So if there is a cross section of the ramus of mandible, it is a ramus of the mandible. The muscle that you will see present on the outer surface of ramus of mandible is a masseter muscle. Well, I'm sure that you all know that the big tough muscle that we have on the side here. If you clench your teeth or tightly band karte, what muscle you feel on the outside, that is where it gives sensory. But the buccal nerve is sensory nerve to the, it is sensory nerve to the skin of the cheek and also the mucosa of the cheek here. उसको skin को भी sensation supply करना है और mucosa को भी, and that's why it is sensory branch. It is piercing Buccinator but not supplying it here. So this muscle here is the masseter muscle, that is the strongest muscle of mastication. And what you will see that parotid duct, the Stenson's duct or parotid duct is running superficial to it. Like मान लेते हैं, if this is a parotid gland here guys, if it is a parotid gland, so this parotid duct is running superficial to this masseter muscle, and then it is piercing multiple structures to go inside and open in the oral cavity. So this duct here is the parotid duct or the Stenson's duct. Now what are the structures pierced by the parotid duct? Well, you can remember them as B, 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 M, triple BM. There are 4 structures which are pierced by the parotid duct in the sequence. This is pehla B. First B is the buccal fat. There is a buccal fat. So it's a buccal pad of fat which is pierced by it. सबसे पहले fat को pierce करेगा. The second B stands for a fascia that is called as a buccopharyngeal fascia. That is a buccopharyngeal fascia. Let me try to write down in a way that you should be able to read my annotated PDF. And the third B here is the buccinator muscle that we just talked about. The buccinator muscle is pierced by the parotid duct. So the third B is for the buccinator. And M stands for the mucous membrane. M is for the mucous membrane. And mucous membrane, it is piercing this, or it is opening in the vestibule of mouth opposite second molar, obviously upper second molar. Opposite upper second molar tooth. That again is a question, guys. That parotid duct open कहाँ पर हो रहा है? Parotid duct is opening in the vestibule exactly opposite to upper second molar. It is opening exactly opposite upper second molar. So this is one question. There's another question which is pierced by the parotid duct, that is the four structures there. And in the sequence of B, 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 M, सबसे पहले buccal fat, then fascia, buccopharyngeal fascia, then the muscle, buccinator muscle, and then it is finally piercing the mucous membrane. So that's the structures pierced by the parotid duct. So again, if the question is asked about on the buccinator muscle or about the Stenson's duct, I hope you will be able to answer that. Okay. Yes, perfect, guys. Well, I'm pretty sure that I love to believe that you people have read all these things, and what I'm doing is just a quite quick revision of all these things, so that when you look at the PYQs, again I keep saying that whenever you look at the PYQs, you not just be looking at the PYQs, you should be knowing more around that. आपको लगना चाहिए कि यार ये question अगर examiner ने twist भी किया, if they try to change a normal question into the image based, or the image based question into the usual question, or the core anatomy question into the clinical one, I will be able to answer that question. Then you will get that confidence, okay, कि जो मर्जी पूछे, I'm ready for it. Okay, so guys, let's fall back again. So that is about the buccinator muscle. Now coming to the, as I told you, the something which is sitting on the top of the food chain, that is the muscles of mastication, guys. Let's have a little discussion on the muscles of mastication and how these muscles of mastication, how to identify these muscles, and what are the different actions that we can see from these muscles. Well, yeah. So I've kept a picture for you in this. Okay. Now, guys, I've kept different picture for different muscle here. See, first of all, when it comes to muscle, एक overall idea how the muscle looks like is important, because abhi in the recent INICT exam and earlier also, they've even asked the question about the attachment of these muscles. So it's not the detailed attachment. Nobody is going to ask you, like you read in first year, it is coming from the temporal lines or 2/3 of the temporal fossa and all that. No, not that kind of question. But a broad understanding of where the muscle is originating and inserting, you should know about it. So that if it is an image-based question, even in the sectional anatomy, you should be able to identify it. Look, the muscle that you're looking at here, guys, this muscle is the temporalis. That muscle is temporalis. Yes, Janvi, I totally agree that, and in fact, other people that lateral pterygoid is one of the commonly asked question here. But again, other muscle we should know about it. So guys, we all know there are 4 muscles of mastication. There is temporalis, there is medial pterygoid, lateral pterygoid, and masseter. So pehle temporalis muscle, guys, this muscle here is a temporalis muscle, as you can see. Now, if I enlarge this picture, you will notice that temporalis muscle is coming from the temporal fossa. That's a temporal fossa here. And it is inserted onto this process of the mandible, which is called as a coronoid process. Look at this process, guys. This process here is the coronoid process. So whenever you're looking at any muscle, it's not just the muscle of mastication, upper limb, lower limb muscle. You always need to think that when the muscle contracts, insertion will be pulled. Origin to nahi hilega na. Insertion will be pulled. So the action of the muscle is at the point of insertion, and each and every muscle of mastication is inserted on the mandible. Mandible is insertion, guys. Whatever you see on the skull bone is origin, mandible pe hi insertion hoga. So obviously when the temporalis muscle will contract, now look at the fiber carefully, guys. You can see the temporalis muscle, ye wale jo fiber hai temporalis ke, they are going to pull the mandible upward. But you can even see the temporalis fibers are pulling it backward also. So the two action of this muscle is going to be the E is for the elevation. The elevation, which is a strong action of this muscle, that elevation. and the second action is the retraction. Elevation and retraction are the two functions of this muscle. Now, the point is, अगर दोनों option में दिए हो, which one will you choose? Elevation. The main action of the temporalis muscle is elevation. Retraction हमने तब mark करना अगर आपसे पूछे कि what is the unique action of this muscle, because और कोई muscle retraction नहीं कर सकता. The only muscle which can do the retraction of the mandible is temporalis muscle. So please understand, if a muscle is given to you and they ask you, okay, what is the action of temporalis muscle? Go with elevation as the answer. Elevation is the default answer, right? But if the question is asked, okay, what is the unique action of temporalis muscle which cannot be done by any other muscle? Then is a retraction. अगर दोनों option में दिए हैं, retraction and elevation, nothing like that. You can go for both of them if you can choose both of them. But otherwise, you have to choose the best answer. Go with elevation as your main answer. Retraction is a unique action of this muscle. And again, no rocket science here, guys. You're just looking at the muscle and you're visualizing the muscle fiber when it is contracting. It is pulling the mandible in what direction? Pulling the mandible in what direction? That is what we have to notice. Look at the second muscle there. Now, temporalis is already done, guys. Now I'm looking at the muscle that is a masseter. The second muscle that I'm looking at here, that is the masseter muscle. Now, in the masseter muscle, guys, again, this muscle थोड़ा confusing लगता है because when you look at this muscle, it looks like it is the insertion because the whitish tendon can be seen there. But don't get confused, it is the origin. You cannot have an insertion on the zygomatic bone. Zygomatic bone तो fixed रहेगा ना. So this is origin and again this is the insertion. Insertion is on the mandible, on the outer surface of mandible. So when the masseter muscle contracts, look at the fibers, guys. They are going to pull the mandible in this direction. Clearly, they are going to pull the mandible upward. So again, for the masseter muscle, the main action of masseter muscle is also elevation. Is elevation, guys. Clenching of teeth. जोर से आप बंद करते हैं अपने jaw को. That done by the muscle, that is masseter. You can always feel that strong muscle on the outside. That is a masseter muscle. So elevation is the main action. It helps in protraction. देखो protraction इसका definitely main function नहीं है, but yes, the main action is elevation, but it helps in protraction. So if the question is asked to you, again elevation is going to be your best answer. It helps in protraction. That is also true because the fibers are not straight, they're kind of forward. They're pulling the mandible slightly forward also. Yeah. Then now look at this, and this is where you have to be careful with. Guys, masseter muscle is present on the outer surface of ramus of mandible. Mandible के बाहर है masseter muscle. If I remove the masseter muscle, I will be able to see the mandible. Like in the next picture, I can see mandible there. And then I can see another muscle present inside the mandible, and that muscle is medial pterygoid. So just the direction of the masseter muscle is like this. Even medial pterygoid is in the same direction only. The only thing is the masseter muscle is outside the ramus of mandible and medial pterygoid is inside the ramus. So ये देखना आपको कि which muscle is inside and which one is outside. So guys, this muscle now we're looking at is a medial pterygoid. Now let me tell you one thing about the origin of the medial pterygoid muscle. इसका origin कहाँ पर, guys? The muscle originate. It originate from, now this is where to give, from the medial surface. From the medial surface of lateral pterygoid plate. The muscle is going to originate from the medial surface of lateral pterygoid plate. Can you see a plate over there? आपको pterygoid plate दिख रहा है यहाँ पे, guys? Look at that blue, no, my blue pointer here. The lateral pterygoid plate will give origin to lateral pterygoid also, medial pterygoid also. तो ये lateral pterygoid plate change नहीं होगा. The point is, lateral pterygoid muscle will be coming from the lateral surface. Medial pterygoid will come from the medial surface. But plate कौन सा है? Do not forget it's the lateral pterygoid plate. Medial pterygoid plate is not giving origin to the muscle of mastigation. It's the lateral pterygoid plate, lateral surface and medial surface. So it's the medial surface of the lateral pterygoid plate, medial pterygoid is originating from. And then you can see it is inserting on the inner side of ramus of mandible. But iska action bhi kya hai? Same thing. Just like the masseter muscle, direction is same. So the action is also same. The muscle is also responsible for elevation. Elevation. And again, same story, guys. It also helps in protraction. It helps in protraction. Undoubtedly, the best answer is once again elevation. Medial pterygoid is doing the elevation. Yeah. Commonly, yes. But a maxillary tuberosity is one of the origin here. Medial pterygoid plate and maxillary tuberosity. But you know, if the detailed origin nahi jana hai, what you're saying is absolutely right. There is a tuberosity which is present behind the upper jaw, and that is called as the maxillary tuberosity. One of the head which is also called a superficial head of this muscle is coming from maxillary tuberosity. But we don't have to go into that kind of detail. If it is an image-based question, you need to identify the muscle in that. If it is simply the question asked on the action, then elevation is your best answer. And finally, then there comes the lateral pterygoid muscle. Lateral pterygoid. Now guys, what makes this lateral pterygoid muscle so special? Lateral pterygoid muscle is one of the most asked muscle in the exam. And I'm again not just talking about the FMGE exam, I'm talking about the NEET and INICT also, because lateral pterygoid is having this one unique action which is making it very special. It is the only muscle which opens the jaw. The three muscles that we wrote earlier, elevation, 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 सब में common है, but depression किसी में नहीं है. These muscles, this lateral pterygoid muscle is the muscle which helps in the opening of the jaw. So depression of the jaw or opening of the mouth is done by the lateral pterygoid muscle. Now where is lateral pterygoid muscle in this picture, guys? Look at that highlighted muscle there. That's lateral pterygoid. Now it is muscle is again having one upper head and lower head. Again, you don't have to go into that. आपको बस याद रखना है कि lateral pterygoid muscle. Now this one originate from lateral surface of lateral pterygoid plate, guys. This time it's a lateral surface of lateral pterygoid plate. And let me tell you, this is a question asked in this INICT also. Lateral surface of lateral pterygoid. It was an image based question on the lateral pterygoid plate, and the question was asked about the muscle attachment. That's a lateral pterygoid muscle. Well, the muscle, guys, this muscle, lateral pterygoid muscle, if I may show it to you, see, this muscle is going to pull the neck of the mandible slightly downward and it will take it forward. So दोनों action बड़े important है. But again, the main action of this muscle is a depression. Opening of mouth, depression is the major action of this muscle. And this muscle also helps in the protraction. Yet another muscle for the protraction. But again, आपको choose करना हो between protraction and depression. Please go with the depression as the best answer. When it comes to muscle of mastication, guys, जब भी आपको main action choose करना हो, go with elevation and depression. Which muscle is closing the mouth, which is opening the mouth, that is a preferable answer. ये sideways movement, protraction, retraction, ये secondary answers है. So always go for the major action, which is opening and closing mouth for any of these muscle of mastication for that matter. Yeah. See, whatever you're looking at on the screen, guys, all the muscle that we just talked about here, all these actions are basically bilateral actions. When we talk about temporalis, masseter, medial pterygoid, lateral pterygoid, जब ये दोनों साइड पे contract कर रही हैं, तो this is what they're causing. Now the point is, what is the unilateral action of these muscle? If there is only like contraction of one side, what will happen? And especially about the pterygoid muscle, medial pterygoid and lateral pterygoid muscle, if they contract only on one side, if they contract, they're going to deviate the jaw toward the other side. Like look at me, guys. If I deviate my jaw toward the left side, my deviation of jaw toward the left side is done by the contraction of the lateral and medial pterygoid of what side? Right side. तो अगर आप एक साइड के टेरिगोइड को कॉन्ट्रैक्ट करेंगे तो आपका जॉ ऑपोजिट साइड में जाएगा. सो दैट अगेन इज एन इंपॉर्टेंट पॉइंट टू बी नोटेड. लेट मी जस्ट कीप योर नोट्स लिटिल ऑर्गेनाइज्ड. So if there is a unilateral contraction, unilateral, only one side, unilateral contraction of pterygoids. So if there is a unilateral contraction of pterygoids, then you will see the jaw deviates to contralateral side. So that's the kind of question they can ask you, guys, that if a person is contracting medial and lateral pterygoid of the left side, what will happen to the jaw? The jaw will go toward the right side, like opposite side mein jayega. The contraction will deviate the jaw toward the other side. That's a unilateral action. Generally, when the question is asked about the muscle, they will ask you the bilateral action. I mean, आपको मान के चलना है कि if the muscle is given in the exam, तो आप वो पूछ रहे हैं कि what is the bilateral action of this muscle? Unless they specifically ask you about the unilateral action, they will definitely mention it in the question. Right, so this is about the muscles of mastication. I hope that if you get a question on that, you will not get it wrong. चलिए वापस आते हैं अपने लिस्ट पर, guys. So again going back, so we discussed about this muscle of mastication. Now, another question, another osteology based question is on the Tyrion and middle meningeal artery relation. Now, when it comes to Tyrion, guys, the question is not just about the Tyrion. It's about the bone forming the Tyrion, structure deep to the Tyrion. और ये क्वेश्चन इतनी बार आ चुका है कि they're not just talking about the deep to Tyrion, they're asking about the superficial to Tyrion also. So let me place this image appropriately. Yeah. Now I'm sure that this circle that you're looking at here, it is one of the weakest area of the skull bone that you're looking at right now, guys. This is what you call as a Tyrion. Right. So the question here is, what are the bones first of all contributing to Tyrion? That's one question. Now, obviously, this H-shaped suture, there are 4 bones which are contributing into the Tyrion, out of which the first bone which I'm pointing at right now, guys, this is the frontal bone. Now, this is one straight question here, that bones contributing to the Tyrion, guys, that is frontal bone. The second bone which is contributing to Tyrion here, that is the parietal. The next 2 bone are important because you need to be very specific in that. Guys, this bone here, which I'm pointing at right now, which is contributing to Tyrion, is the greater wing of sphenoid. It's the greater wing of sphenoid. And the 4th bone which is contributing to this Tyrion area is the squamous part of temporal bone. So just saying the temporal bone is not enough. It's a squamous part of temporal bone, not the petrous part. It's a squamous part of temporal bone. So that is one question here. That ये जो Tyrion आपको दिख रहा है, the 4 bones which are contributing to this is the frontal, is the parietal, is the greater wing of the sphenoid, and the squamous part of the temporal bone. Squamous part of temporal bone. So especially be careful with this squamous part of temporal bone and the greater wing of the sphenoid. So this is one question here, that Tyrion में कौन कौन सी आपकी 4 bones present है यहाँ पर. Okay. Then the question is, why this point is so important, guys? This is the weakest area of the skull bone. Any blow to the lateral side of the skull can lead to the fracture of the Tyrion. ये बड़ा easily fracture भी होता है. In fact, surgically also, the burr hole can be done through this to this Tyrion, and the surgeon, the neurosurgeon, can access the middle cranial fossa through it. So what are the structures which are lying deep to it here? So if there is a fracture, if there is any trauma at the Tyrion region, what are the structures which are likely to get involved? Now, middle meningeal artery बहुत बार पूछ लिया यार. Now everyone knows the middle meningeal artery is lying deep to it. The question is, what else is lying deep to the Tyrion is something that we have to focus on. So yes, in the Tyrion, the deep relations, guys, when I say deep relations of the Tyrion, I'm talking about the structure lying deep to the Tyrion. This is one is the anterior division of middle meningeal artery, or you can say frontal trunk of middle meningeal artery. एक ही बात है, anterior division of middle meningeal artery. And you know that this rupture of the middle meningeal artery can cause extradural hemorrhage. So if there is any rupture of this middle meningeal artery due to the fracture of this area, that can lead to the extradural hemorrhage. I hope you must have seen that idli shaped extradural hemorrhage in the radiology class as well. What else? What else is lying deep to this? Deep to the Tyrion, guys, आपको यहाँ पर you'll also find the Sylvian point deep to it. What is Sylvian point? It's the beginning of the lateral sulcus on the lateral surface of the brain. Like, let me just tell you guys, when you look at the cerebrum, look, ये जो point आपको दिख रहा है, that is called as Sylvian point here. This is the point from where you can see this lateral sulcus going backward. That's a Sylvian point. That is also lying deep to the Tyrion. A blood vessel running into this Sylvian sulcus, or Sylvian, I should say, cistern there, is the middle cerebral artery. Though we are going very deep inside, but that is exactly lying at the level of the Tyrion here. Middle cerebral artery भी आपको अंदर मिलेगा. Broca's area. You will also find, what else you will find in this area? If you go further deep inside, insula is also there. If you open the lateral sulcus from the Sylvian point, insula, the hidden area of the brain, insula is also there. And from the bone point of view, lesser wing of sphenoid, guys. Please understand, greater wing of sphenoid is contributing to the Tyrion. Lesser wing of the sphenoid is present in the relation. These are the important deep relation of the Tyrion. I know the question 90% of time is asked on the anterior division of middle meningeal artery. No doubt about that. They will. I still hope that they will continue asking about the middle meningeal artery. But if they go a little beyond there, because ये question इतनी बार पूछ चुके हैं कि अब मुझे लगता है कि कुछ नया they won't want to ask here. The structure lying deep to the Tyrion, it's not just the anterior division middle meningeal artery. We have a Sylvian point, we have middle cerebral artery trunk is seen. Broca's area, अगर आप देखेंगे, inferior frontal gyrus having Broca's area is also there, obviously on one side. and then we have insula. The insula is a hidden cortex. So if you open the sylvian sulcus, if you open this lateral sulcus, you'll find the insula also there. And bony relation में lesser wing of sphenoid. Greater wing of sphenoid is contributing to the Tyrion. Lesser wing of the sphenoid is related to the Tyrion. Deep relation to the Tyrion में आ जाएगा. So all these structures can be asked here. So if they go a little deep into this, I hope that you will be able to answer this question more efficiently. Okay, चलिए वापस आते हैं फिर से अपने लिस्ट पे. So we're done with this Tyrion and the middle meningeal artery thing here. Now come to the next thing, guys, that is about the gang. It was a question asked about which of the following ganglion supplies the lacrimal gland. And I said, just knowing the lacrimal gland is not good enough for us, because lacrimal gland को अगली बार parotid gland पूछ सकते हैं, they can ask you submandibular gland. So I should know the innervation of the other glands also and not just the lacrimal gland here. So how about we look into this topic that way? So talking about the gland innervation, let's start in this way. I should know that what is the nucleus present in the brainstem, what is the nerve coming out from that nucleus, कौन से ganglion में जाके relay करेगा, and then from that ganglion the nerve going to reach the gland. So let's look at the whole thing here. So let's talk about the gland innervation. Okay, how about we start with if you're talking about the gland innervation, guys, let's start with the nucleus, which is called as the superior salivatory nucleus. So there's a nucleus present in the brainstem, the superior salivatory nucleus. ये superior salivatory nucleus कहाँ पर होता है? Pons के अंदर, guys. Superior salivatory nucleus is present in the pons. And let me put this inferior salivatory nucleus also, which is also present in the pons. So first thing first, the two salivatory nucleus, we have superior salivatory and inferior salivatory nucleus. Let me just put it this way. And both these nucleus are present inside the pons. ये दोनों ही pons पर रखे हुए हैं. So the part of the brainstem where these nucleus are present, let me do that for you. They're both present in the pons. But a nerve which is coming out of the superior, or I should say the nerve of the superior salivatory nucleus, is the facial nerve. Facial nerve is the nerve for the superior salivatory nucleus. जबकि inferior salivatory nucleus की जो nerve होती है, that nerve is the glossopharyngeal nerve. What superior salivatory nucleus will do, facial nerve coming out of it, I'm sure that you all read about the facial nerve in detail in ENT class also. I just want to take your attention to the two branches of facial nerve, two specific branches of facial nerve, guys. One of the branch of facial nerve which I'm pointing for you here is the greater petrosal nerve, the GPN. I hope you read about this petrosal nerve, guys. Greater petrosal nerve, that is. Now, greater petrosal nerve is a branch of the facial nerve which is going to relay in one of the ganglion, one of the parasympathetic ganglion of head and neck, and that ganglion is a pterygopalatin ganglion. That ganglion here is a pterygopalatin ganglion, and this pterygopalatin ganglion will give up the post ganglionic fibers. यहाँ से जो post ganglionic fibers निकलेंगे, they are going to supply the lacrimal gland, and they're even going to supply the nasal glands also. So आपसे lacrimal gland पूछा, guys. If they ask you nasal gland also, then you still again know the answer here. So ganglion is a pterygopalatin ganglion. If the question is asked which ganglion is supplying the lacrimal gland, so answer to that question is the pterygopalatin ganglion. इसको हम sphenopalatine ganglion नहीं बोलते हैं. Pterygopalatin और sphenopalatine ganglion is also there. Okay, but lacrimal gland and nasal gland are the one which are supplied by this branch of the facial nerve coming from the superior salivatory nucleus. What about the another nerve? Another branch from the facial nerve that I'm talking about is a cauda tympani nerve, guys. Another nerve which I'm pretty sure everyone knows about, that is cauda tympani nerve. Cauda tympani nerve, branch of facial nerve. Cauda tympani nerve will join the lingual nerve, and with that it is going to relay in the ganglion, the another ganglion now, guys, and this time the ganglion is the submandibular ganglion. I'll tell you more about this ganglion location in the upcoming question. So this time the ganglion name is a submandibular ganglion, and the post ganglionic fibers coming from submandibular ganglion, they are going to supply the submandibular and sublingual gland. Submandibular B or sublingual gland, guys, both are supplied by this. So again we are preparing for what could be the next question. एग्जाम में पूछा लैक्रिमल ग्लैंड कौन से गैंग्लियन सप्लाइड है, टेरिकोपेलेटन गैंग्लियन. नाउ यू नो द आंसर फॉर नेजल ग्लैंड ऑल्सो, सबमैंडिबुलर ग्लैंड ऑल्सो, सबलिंगुअल ग्लैंड ऑल्सो. दिस इज स्टिल नॉट द एंड ऑफ द स्टोरी. अब आते हैं inferior salivary nucleus. Guys, inferior salivary nucleus, the nerve of the inferior salivary nucleus is the glossopharyngeal nerve. Ninth nerve is the nerve for the inferior salivary nucleus. There are multiple branches of of the glossopharyngeal nerve. Let me take you to the branch, guys. There is a branch of this glossopharyngeal nerve called as a Jacobson's nerve. Jacobson's nerve will form a plexus in the middle ear that is called as a tympanic plexus. I hope you read about this tympanic plexus. और उसके बाद tympanic plexus से एक nerve निकल के आएगा. That nerve which is coming out of the tympanic plexus, that nerve is called as a lesser petrosal nerve. That's a lesser petrosal nerve. Also keep an eye on these now, guys. This was a greater petrosal. This was cauda tympani. Now I'm talking mainly about what now? Lesser petrosal nerve. So ultimately it's a branch of glossopharyngeal nerve only. Jacobson's nerve, tympanic plexus. Ultimately the nerve is lesser petrosal nerve. Lesser petrosal nerve will go and relay into the ganglion. और इस बार ganglion कौन सा है? इस बार the ganglion is the submandibular, otic ganglion. Sorry, this time it's the otic ganglion. This time the name of the ganglion is the otic ganglion, and the post-ganglionic fibers from otic ganglion are going to supply what gland? They're going to supply the parotid gland. They supply the parotid gland via auriculotemporal nerve, but important चीज ये कि ganglion कौन सा है, and this time it is the otic ganglion. So guys, at least from this gland point of view, without going into too much of detail, मुझे लगता है इतना तो आपको पता होना चाहिए कि न्यूक्लियस क्या है, superior salivary, inferior salivary nucleus, what are the nerve coming from these nucleus, and then which ganglion is supplying what gland. So lacrimal gland पूछिए, nasal gland, submandibular, sublingual, parotid gland, आपको सब gland के ganglion पता होने चाहिए, tericopalatine, submandibular और the otic ganglion. Okay. So guys, I hope that I'm making myself clear to you. We are going with a pace which is not bothering anyone. चलिए सर वापस आते हैं. So this was about the gland innervation, जिसमें हमने lacrimal gland और we saw other. Now coming to the lesion of the facial nerve, guys. Now facial nerve, let me tell you something about the facial nerve injury, and then we have the question about the submandibular gland and some nerve which can get injured in the submandibular gland surgery. And I'll also tell you about the rule from where the image-based question is very much likely to ask. That is about the rule of 17. Right? Well, let's have a talk about this facial nerve का upper motor neuron and lower motor neuron lesion, and what kind of different question they can put on the lesion of the right side nucleus को है या upper motor neuron को है, lower motor neuron को है, and how it is going to look like. So I'm going to take help of this picture. Okay, so guys, I'm using this image which I drew for you to make you understand about the upper and the lower motor neuron lesion of the facial nerve. So what you're looking at right now in the picture, first of all, this is the cortex here. That's a cerebral cortex, right? So let me just keep on highlighting these areas. That is a cerebral cortex. Then in the pons, we have the facial nucleus present. That yellow highlighted thing here, these are the facial nucleus. Motor nucleus of facial nerve और motor nucleus of facial nerve कहाँ पर होते हैं? They are present in the pons. Motor nucleus of facial nerve present कहाँ पर है? Pons के अंदर present. They are present in the pons. Thank you, Scavenger. I appreciate that. So obviously अगर कोई भी न्यूरॉन का इस कॉर्टेक्स से न्यूक्लियस तक जाएगा, that is upper motor neuron. Obviously from the cortex till the pons, वो तो it is running inside the central nervous system only. So that is upper motor neuron. And when you will see any neuron going from the nucleus to the face, supplying the muscle, that is lower motor neuron. Everyone knows that these are upper motor, that is a lower motor neuron. Now I gave the different color to that because I want to look at something very specific here. Let's start with the lower half of face. Guys, एक चीज देखो, those neurons, these are lower motor neurons, those neurons which are supplying the lower half of face, only the lower half of face, their upper motor neuron is coming from contralateral side. Just look at this, the highlighted point which I'm showing you guys. आप सिर्फ इस पे नजर रखो. Lower half of face is supplied by the upper motor neuron coming from the contralateral side, जो opposite side से आ रहा है. Just look at this blinking line here, right? Lower half की बात कर रहे हैं. But upper half of the face, the forehead muscle is supplied by the neuron जिनके upper motor neuron दोनों साइड से आ रहा है, यहाँ से भी आ रहा है, and look at that, it's coming from this side also. So that's the thing, that upper half of the face or the forehead muscle are supplied by both cortex, right and left cortex here. So that is the thing to be noticed in the facial nerve, upper and lower motor neuron. Why it is important? Because now let's say if you have a patient who's having a nuclear or the infranuclear injury, that means the injury is somewhere here, guys. That means it is a lower motor neuron lesion. That is going to be a lower motor neuron lesion. And if the injury is somewhere here, like between the cortex and the nucleus, could be anywhere, internal capsule में हो सकता है, it could be in the brainstem, mid brain के अंदर injury हो सकती है, that will be a upper motor neuron lesion. So let's say if you have a patient who's having a lower motor neuron lesion, guys, lower motor neuron ही चला गया, अगर तार ही कट गया तो करंट ही नहीं जाएगा नीचे. If the lower motor neuron is cut, obviously the entire face of that particular side, all the muscles are gone. Flaccid paralysis हो जाएगा. That means there will be a paralysis of the same side of the face and complete paralysis, guys, top to bottom. Every muscle of the face will get affected of that side. That's why in the lower motor neuron lesion, the patients, they have what? Ipsilateral facial paralysis, same side. So there will be ipsilateral facial paralysis. So let's say if the patient comes to you with a lower motor neuron lesion, so whichever side lower motor neuron, guys, अगर right side का facial nerve जाएगा तो right side का facial paralysis, left side का left side का facial paralysis, and the entire face will be gone. Forehead be, the cheek muscle, the upper lip, lower lip muscle, सारी muscle infecting it. But what will happen in upper motor neuron lesion, guys? Look at the red line there. The red line there are corresponding to the nerve fiber which are supplying the upper half of face. लेकिन upper half of the face is fortunate because it is supplied by the other side also. तो यानी कि बेटा forehead तो बच जाएगा, forehead will be spared because forehead का supply is coming from the other side also. But it is a unique supply to the lower part of the face, and that is why in case of the upper motor neuron lesion, when you have a patient with the upper motor neuron lesion, first of all they will have a contralateral paralysis, and that too of what? Lower half of the face. Forehead muscle बच जाएंगे because they have a bilateral innervation, उनको दोनों साइड से innervation आता है. So upper motor neuron lesion, there will be contralateral paralysis of only lower half of face, or you can say lower part of face. Contralateral paralysis of lower half or the lower part of face, that will be seen here. So it's very important to understand in this diagram here what is upper motor neuron, lower motor neuron, which part of the face is getting a bilateral innervation. वो forehead muscle है जिनको दोनों साइड से innervation आता है. But lower half of the face, when this if you talk about the muscle in this area, they get the innervation only from one side, and that too from contralateral side. So the muscle that right now I'm pointing with my hand, ये जो muscle है इन सब का innervation इस side की cortex से आएगा. And similarly this lower part of the face on the left side will have a right side cortex supplying it here, contralateral supply. So contralateral facial paralysis of lower half of face will be seen in upper motor. So generally when we talk about these lesions in the central nervous system, guys, central nervous system के अंदर कोई भी lesion होगा, like in the midbrain injury, internal capsule injury, we generally say facial paralysis of the opposite side. But when you talk about the facial nerve injury, when the nerve is coming out of the brainstem, जब भी facial nerve injury होती है, whichever side the facial nerve is injured, the same side facial muscle will also get affected. Right side facial nerve, right side facial muscle will get affected. So that's a difference between the upper and the lower motor neuron lesion of the facial, right? So guys, ये जो lower motor neuron lesion है, that is also called as Bell's palsy. If it is idiopathic, when you don't know the cause, that is Bell's palsy. So if they ask you that what happens in Bell's palsy, it's a ipsilateral facial paralysis. Please remember, injury nucleus को हो या nucleus के नीचे हो, एक ही बात है. Nuclear और infranuclear injury, it's lower motor neuron lesion injury. हाँ, nucleus से ऊपर injury होगी तो there is a upper motor neuron injury, right? Then is upper motor neuron. Then you have to judge your answer based on that. Okay. Now, talking about the facial nerve, guys, let me also tell you, and then I'll tell you about that rule. See, if you look at this again, if you look at the history of the question, can you see the questions which are asked on this patient underwent the left submandibular gland removal, patient underwent the left submandibular gland excision, submandibular gland surgery के ऊपर आपको multiple time questions आए हुए. Now it is important to, that means I should know कि submandibular gland की location कहाँ पर है, and what are the nerves lying close to the submandibular gland. What will happen if those nerves will get injured? उनकी consequences क्या होंगे, और ये question उन्हीं के ऊपर based है, right? So let's look into that way. So here we go. Let me add a few more pages there. Okay, so let's dive a little more inside this submandibular gland. हमने parotid duct की बात की थी. Now we'll talk about the submandibular gland and the duct of submandibular gland. इस टॉपिक को ऐसे लेके चलते हैं guys. There is a muscle which is present. The muscle जिसके ऊपर gland रखा हुआ है, and that muscle is hyoglossus. One of the tongue muscle only, hyoglossus. Let me start with this, guys. Here we go. This is the hyoid bone. The lesser cornua, the greater corner of the hyoid bone. There is a hyoid bone there. पांडा बेटा फोरहेड रिंकल्स देखो. फोरहेड रिंकल्स ना व्हेन आई रेज माय आईब्रोज, देखो मेरे फोरहेड रिंकल्स आपको दिख रहे हैं यहाँ पर. यू कैन सी द फोरहेड रिंकल्स हियर बिकॉज आई एम रेजिंग माय आईब्रो. फोरहेड मसल्स काम कर रहे हैं. दैट्स व्हाई द फोरहेड रिंकल्स आर टू बी सीन हियर. द थिंग इज इफ अ पेशेंट इज हैविंग अ अपर मोटर न्यूरॉन लीजन. ना समझना है इसको. अगर पेशेंट को अपर मोटर न्यूरॉन लीजन है, अपर मोटर न्यूरॉन लीजन का मतलब ओनली लोअर हाफ ऑफ द फेस इज इन्वॉल्व ऑन द कॉन्ट्रोलैटरल साइड. दैट मीन्स दैट पेशेंट विल बी एबल टू हैव अ रिंकलिंग ऑफ द फोरहेड, ही विल बी एबल टू डू द रिंकलिंग ऑफ फोरहेड. लेकिन अगर लोअर मोटर न्यूरॉन लीजन होगा, let's say if there is a right side lower motor neuron lesion, so all the muscles are gone on that side, so I will not be able to raise my eyebrow, I will not be able to wrinkle my forehead on that side here. So wrinkling of forehead is an important indication there कि if a patient is coming to you with a facial paralysis, अगर let's say मैं आपका patient हूँ, if I come to you with a facial paralysis, आपने notice कर लिया कि मेरे को एक side पे facial paralysis हो रखा है और आपने मेरे से बोला कि okay raise your eyebrows. अगर मैं दोनों eyebrow raise कर पा रहा हूँ अपनी, तो इसका मतलब upper motor neuron lesion है because forehead muscles बच गया है. But if I'm only able to raise only one side of the eyebrow, but one side of the eyebrow I'm not able to raise, or there is no wrinkling of the forehead on that side, particular side, that means it's a lower motor neuron lesion. That's why the wrinkling of forehead is an important indication. चलो टॉपिक वापस आते हैं गाइस. सबमैंडिबुलर ग्लैंड के बारे में देखो. दिस इज अ हायोइड बोन. नाउ देयर इज अ मसल व्हिच इज कमिंग फ्रॉम द हायोइड बोन, जो ग्रेटर कॉर्नुआ से ओरिजिनेट होता है. दिस मसल कमिंग फ्रॉम हायोइड बोन इज द हायोग्लॉसस मसल. Look at this muscle is hyoglossus. मान लेते this is the tongue here. So this muscle is hyoglossus. Let me highlight this muscle for you. As guys, again, if somebody joined late, let me tell you here that whatever I'm writing here, आपको ये PDF मिल जाएगा. So just don't worry about that here. Whatever I'm writing, whatever images I'm showing you, ये सब आपको मिल जाएगा. Immediately after the session, they will post. हम basically हमारी जो third video होगी, हम total 3 part में करेंगे. So third video के बाद will post a link where you will find the all entire PDF at one place only. Yeah. So coming back, guys, so this muscle that I'm looking at right now, this muscle is the hyoglossus muscle. The muscle which is basically originating from the hyoid bone, mainly from the greater cornu of the hyoid bone, muscle which depresses the tongue. हमने शुरू में पहले भी डिस्कस किया था hyoglossus muscle. If you look at this muscle, see, there are a couple of important relations that you should know. Submandibular gland. The deep part of submandibular gland is resting on this muscle like this. Though this is a deep part. This is the deep part of submandibular gland. And coming from the deep part of the submandibular gland, thank you, Abhishek. I appreciate your message. Deep part of submandibular gland. The duct coming from the deep part of submandibular gland, obviously we all know that duct is a Wharton's duct. But a Wharton's duct ऐसे ऊपर जा रहा है. Wharton's duct is going and opening in the floor of the mouth. That is a duct. Submandibular duct, also called as a Wharton's duct. Submandibular duct, which is also called as a Wharton's duct. Now there are two major nerve relations आपको पता होना चाहिए. There are other structures also which are in relation to hyoglossus, but I wanted to focus only on two things. One, the lingual nerve will be running like this, superficial to hyoglossus, and you will see lingual nerve is in very close relation to this Wharton's duct, and then it is reaching the anterior 2/3 of tongue. Lingual nerve is also connected to a ganglion that is a submandibular ganglion. मैंने बताया भी था आपको submandibular ganglion. So that's the lingual nerve which is there, and there's another nerve that you will see present in the lower part जो gland के नीचे present है, also running superficial to hyoglossus. This is the hypoglossal nerve. Hypoglossal nerve. तो देखो यार, जब भी आपसे क्वेश्चन पूछेंगे ना रिगार्डिंग सबमैंडिबुलर ग्लैंड सर्जरी, आपसे दो ही नर्व इंजरी के बारे में बोल सकते हो. या तो आपसे बोलेंगे कि लिंगुअल नर्व में इंजरी हो गया है बिकॉज लिंगुअल नर्व इज जस्ट अबव द ग्लैंड, और ये आपसे बोलेंगे हाइपोग्लॉसल नर्व की इंजरी हुई है. राइट. तो पहली बात तो ये कि व्हेनेवर द क्वेश्चन इज अबाउट द सबमैंडिबुलर ग्लैंड रिसेक्शन, सबमैंडिबुलर ग्लैंड सर्जरी, सबमैंडिबुलर एक्सिजन, वॉर्टन्स डक्ट सर्जरी, ये दो ही लिंगुअल नर्व एंड हाइपोग्लॉसल नर्व. वेल पहले चलते हैं मोस्ट कॉमन के ऊपर. सो द मोस्ट कॉमनली इंजर्ड नर्व इज अ लिंगुअल नर्व. If both are given in the option and the question is that which is the most commonly injured nerve in the submandibular gland surgery, then you have to go with the lingual nerve is the best answer. Especially अगर Wharton's duct पूछा हुआ है कि there is a stone in the Wharton's duct. If a surgeon is trying to remove the stone from the Wharton's duct, which nerve will get injured? कोई doubt ही नहीं है कि the nerve which is closest to that is what lingual nerve will get injured here. The question is कि consequences क्या होंगे? If lingual nerve will get injured here or glossopharyngeal nerve, hypoglossal nerve will injured, so what are the consequences? So दो ही nerve पे question पूछेंगे, या तो lingual nerve या hypoglossal nerve. But the question is what are the consequences? Now look. Lingual nerve injury, guys. I'm putting this sign for the injury. If the lingual nerve is injured, what will be the consequences? Now please understand that when there is a lingual nerve injury in this region, in the submandibular region, it is not just the injury to the lingual nerve, it is an injury to chorda tympani also. अब वो कैसे? Chorda tympani nerve, I hope you all know guys, chorda tympani nerve joins the lingual nerve and then reaches the submandibular ganglion, supply the gland, carry the taste sensation. यानी कि chorda tympani जो भी function करता है, whatever is done by the chorda tympani nerve is done via which nerve? Via lingual nerve. So chorda tympani is joining the lingual nerve and then it is doing its function. So it's very important to know that if the lingual nerve is injured in this region, it's not just injury to the lingual nerve, ये chorda tympani को भी injury है. And that's why the patient will have the sensory loss on anterior 2/3 of tongue. It's a general sensation, guys. General sensation loss on the anterior 2/3 of tongue. But because chorda tympani nerve being involved while it is joining the lingual nerve, so there is a taste sensation loss on anterior 2/3 of tongue. So anterior 2/3 of tongue से दोनों sensation जाएंगे, general भी और taste sensation भी. देखो please understand my point. Question में तो यही mentioned है कि lingual nerve की injury हुई है. But despite it is an injury to lingual nerve, you have to presume कि chorda tympani function is also affected. Because chorda tympani will do its function with the lingual nerve. अगर lingual nerve ही नहीं है तो chorda tympani क्या करेगा? So that's why the injury is to the lingual nerve, but the patient will have general sensory loss from the anterior 2/3 of tongue as well as a taste sensation loss from the anterior 2/3 of tongue. If the question mentions that there is a hypoglossal nerve injury, guys, if there is a hypoglossal nerve injury, in that case, if there is a hypoglossal nerve injury, that case there is a ipsilateral tongue paralysis. There is a ipsilateral tongue paralysis, and ipsilateral tongue paralysis में there is deviation of tongue to ipsilateral side. अब ये सुनने में एक बार को अजीब लगेगा, ipsilateral side कैसे? If there is injury, if there is an injury to the particular muscle, the deviation should be toward the contralateral side. अगर right side की muscle injured हुई है तो the structure should go toward the left side, right? ऐसा होना चाहिए. But that is again something unique about the hypoglossal nerve. कि when there is a hypoglossal nerve injury and you ask the patient to protrude the tongue, you will see the deviation is actually toward the same side, toward the ipsilateral side. Now, let's do one thing. Let me just show you the picture. And क्योंकि first of all, if you get a question on the submandibular gland surgery, you know कि दो ही nerve injured हो सकते हैं, lingual nerve या hypoglossal nerve, and you know कि what are the consequences. एक में tongue paralysis होगा, muscle paralysis, और एक में sensory loss है. So which nerve is what? You should know that. Now let me go back and take that picture and tell you about this rule, because it's not just about the tongue paralysis, it's about that which, like facial nerve injury, vagus nerve injury, what are the different consequences you can expect in this here. And it's a very important rule क्योंकि इसमें से image based question आने के chances बहुत ज़्यादा हैं. So I would want you to take this seriously. Guys, it is something called as the rule of 17. देखो यार, rule of 17 क्या कहता है? According to the rule of 17, we can write the 17 in two different ways. हम इस 17 को दो तरीके से लिख लेते हैं. 1, 10 plus 7 is 17. And you know 12 plus 5 is 17, right? 10 plus 7 and 12 plus 5, दोनों का टोटल 17 ही है. डॉक्टर योगेश, लगता है आपने अभी ज्वाइन किया बेटा, आपको शायद नहीं, मैं पहले बोल चुका हूँ, ये पीडीएफ मिल जाएगा आपको. देखो इस पीडीएफ को शुरू में देने का कोई पॉइंट नहीं था, बिकॉज आई एम राइटिंग ऑन दिस इमेजेस हियर, सो पीडीएफ का कोई पॉइंट नहीं था. यू विल गेट द पीडीएफ ऑफ वॉट एवर आई एम राइटिंग आफ्टर द क्लास, सो डोंट वरी अबाउट दैट. छोड़ दो उस बात को, पीडीएफ आपका है, इट्स योर्स. ओके, so what you see guys, देखो In 10th nerve and facial nerve injury, what you will see that the structure will deviate toward the contralateral side. If there is an injury to the 10th nerve and facial nerve, there is contralateral deviation. आपको जो structure वो supply कर रहे हैं, they will deviate toward what side? Toward the contralateral side. But it is different in hypoglossal nerve and trigeminal nerve injury. The structure will deviate toward the ipsilateral side. There is an ipsilateral deviation of the structure to be seen. And that is why there are 4 clear image-based questions they can ask you here. Like, look at the first picture, guys. In the first picture, can you see the uvular deviation? I hope you can all appreciate that uvular deviation. So this image shows you the left deviation of uvula. अगर left deviation आपको uvula का दिख रहा है, that means it is because of the right vagus nerve injury. आपका right vagus nerve injured हुआ, that's why the uvula is deviating toward what side? Left side. Contralateral deviation. The word is contralateral. मैंने आपको बोला था contralateral side में deviate करेगा. Then look at the next image, guys. Next image आप देख रहे हैं कि angle of mouth, corner of mouth is deviating toward the left side. Patient का उसका face जो corner of mouth is deviating toward the left side. So there is the, again in this picture you can see there is a left deviation of corner of mouth. Left deviation of corner of mouth, it means it is the right facial nerve injury. This patient is having a right facial nerve injury here. Right? So vagus nerve के केस में और facial nerve के केस में, guys, deviation किस side पे है? Toward the contralateral side. So just that's the main thing here. The deviation is toward the contralateral side. दोनों ही केस में right side की nerve injured हुई है और deviation is toward the left side here. But in hypoglossal nerve injury and mandibular nerve injury, ipsilateral side पे deviation होता है. So as you can see in this case here, can you see the tongue deviating toward the left side? So this is a left deviation of tongue. When you ask the patient to protrude the tongue deviates toward the left side. Well, this is because of the left hypoglossal nerve injury only. इस बार सेम साइड की नर्व इंजर्ड हुई है, लेफ्ट साइड की नर्व इंजर्ड होगी तो लेफ्ट साइड में डिविएशन होता है. एंड सिमिलरली ट्राइजेमल नर्व, स्पेशली मैंडिबुलर नर्व की बात कर रहे हैं, एज यू कैन सी द जॉ इज डिविएटिंग टुवर्ड द लेफ्ट साइड. द जॉ इज डिविएटिंग टुवर्ड द लेफ्ट साइड. सो इन दिस केस यू आर लुकिंग एट द लेफ्ट deviation of jaw, left deviation of the jaw or mandible. That is because of the left mandibular nerve injury, or you can say left trigeminal nerve injury. देखो, without going into too much of detail of that, बस ये rule of 17 याद रख लो. If it is an image based question, I'm sure you'll be able to answer this question. आप अगर आपको क्वेश्चन uvula पे दिखाते हैं, जिस साइड में uvula डिवेट कर रहा है या कॉर्नर ऑफ माउथ डिवेट कर रहा है, उससे ऑपोजिट साइड का नर्व इंजर्ड है. बट इफ द क्वेश्चन इज अबाउट द टंग और द जॉ डिविएशन, बी केयरफुल. एक में एंगल ऑफ माउथ है, एक में पूरा जॉ है. इफ योर जॉ इज डिवेटिंग टुवर्ड वन साइड, इफ पेशेंट कम्स विद द जॉ डिवेटेड टुवर्ड वन साइड, और द टंग, व्हेन यू आस्क द पेशेंट टू प्रोट्रूड द टंग, जैसे वो जीभ बाहर निकालता है, द टंग डिविएट्स टुवर्ड व्हाटएवर साइड, द सेम साइड नर्व इज इंजर्ड. That is a rule of 17, that whether deviation is seen toward the contralateral side or if the deviation is seen toward the ipsilateral side. Arjun, discussing all cranial nerves, beta, that will be a task. सारी cranial nerves discuss करना, तो उसके लिए तो मुझे अलग से 3-4 घंटे चाहिए होंगे. I can, if you want to, just to inform you people, if you want to go into a little more detail about the major cranial nerves, so you'll find that topic of mine on the YouTube channel, DBMCI का जो दूसरा YouTube channel है, which is DBMCI for the NEET PG, उसमें आपको वाली वीडियो मिल जाएंगे if you want to watch that. So but right now let's focus on the question which are asked in the previous year, because it's a quick revision. It's the area where we're just revising the stuff which is commonly asked and recently asked also, and we are looking around it कि मुझे उसके अराउंड क्वेश्चन आते हैं तो मैं कैसे उनको सॉल्व करूंगा. सो क्रेनियल नर्व बेटा बहुत बड़ा टॉपिक है. इफ यू हैव एनी पर्टिकुलर डाउट यू कैन आस्क मी, आई डेफिनेटली वुड लव टू आंसर यू. चलो, आई होप गाइज यू अंडरस्टूड दिस रूल ऑफ 17. दैट इज एन इंपॉर्टेंट रूल फ्रॉम वेयर द इमेज बेस्ड क्वेश्चन कैन वेरी वेल बी आस्क्ड हियर, राइट. ओके, वापस जाते हैं सर क्वेश्चंस की लिस्ट के ऊपर. तो अभी इन द रीसेंट टाइम इन द लास्ट 5 ईयर अगेन, देखो वी जस्ट टॉक्ड अबाउट दिस सबमैंडिबुलर ग्लैंड के बारे में बात हो गई. इसमें लिखा हुआ था यहाँ पर कि द पेशेंट अंडरवेंट्स अ रिमूवल ऑफ द लेफ्ट सबमैंडिबुलर ग्लैंड, द लिंगुअल नर्व वाज डैमेज. तो लिखा हुआ है क्वेश्चन में लिंगुअल नर्व इज डैमेज, तो विच ऑफ द फॉलोइंग स्टेटमेंट इज नॉट करेक्ट. उसमें लिखा हुआ टंग डिविएशन. नाउ टंग डिविएशन विल बी सीन इन द हाइपोग्लॉसल नर्व इंजरी, बिकॉज दे आर सेइंग द लिंगुअल नर्व इंजरी, तो ऑब्वियसली टंग डिविएशन would not be the answer to this question. Will be the answer, will not be seen. Then another question, a patient went with the submandibular gland excision during which hypoglossal nerve was injured. तो दोनों ही क्वेश्चन जो पूछे आपसे recent time में, the nerve was mentioned कि which nerve is injured, right? And this time the question is asked कि what will be seen in this patient, what deficit will be seen. So obviously tongue muscle काम नहीं करेंगी, the tongue will deviate toward the same side. Obviously the movement of tongue will be the issue in that case. Okay, the question about the nerve supply of the larynx above the level of the vocal cord. देखो, nerve supply of the larynx, guys, the reason it is important because you need to know the sensory nerve as well as motor nerve supplying the larynx. So let's have a very quick discussion. Again, it is something to be discussed, must be discussed in more detail in the ENT part. But मैं थोड़ा सा आपको just give you a little idea about the innervation of larynx. देखो, टू अंडरस्टैंड द इनर्वेशन ऑफ लैरिंग्स, इसको ऐसे लेके चलते हैं सर. वेगस नर्व से शुरू कर दो. वेगस नर्व will give off branch, and that branch of vagus nerve will be called as the superior laryngeal nerve. देखो, I want you to understand this with the help of a little diagram here, guys. If this is the hyoid bone, let us say this is a thyroid cartilage, और मान लेते हैं ये हो गया हमारा cricoid cartilage, thyroid cartilage, cricoid cartilage. Now, hyoid bone and thyroid cartilage, there is a membrane between the thyroid cartilage and hyoid bone. That membrane is called as a thyrohyoid membrane. This membrane is a thyrohyoid membrane. And one muscle, guys, the only muscle of larynx जो आपको बाहर से दिखाई देगी clearly, that is a cricothyroid muscle. It's a muscle that is a cricothyroid muscle. देखो, presuming that you people are not writing and you're relying on the notes I'll share with you, so I can go with a certain speed. So thyroid membrane दिख रहा है आपको और cricothyroid muscle दिखाई दे रही है. Now vagus nerve, guys, there is a branch of the vagus nerve which is called as the superior laryngeal nerve. देखो, एक मैं branch से शुरू करता हूँ. एक vagus nerve की branch है superior laryngeal nerve. I'm writing SLN, superior laryngeal nerve. Superior laryngeal nerve mixed nerve है. अगर मैं superior laryngeal nerve के बारे में बात करूँ, guys, it is a mixed nerve. The reason it is a mixed nerve because now it is going to divide in two branches, जिसमें से एक sensory होगा और एक motor होगा. So superior laryngeal nerve divides into two branches. One of them is called as the internal laryngeal nerve. This is ILN, guys, internal laryngeal nerve, which is purely sensory. And one is the external laryngeal nerve, which is purely motor. Internal laryngeal nerve is piercing thyroid membrane and external laryngeal nerve is supplying cricothyroid muscle. So for your information, superior laryngeal nerve की दो branches आपको दिख रही हैं. One of the branch is the external laryngeal nerve. External, guys, नाम ही external laryngeal nerve. It is supplying one muscle and that muscle is what? That is cricothyroid muscle. बस एक ही चीज़ है. It is supplying a cricothyroid muscle. That's it. That's the job of this. That is to supply the cricothyroid muscle. Then there is a nerve called as the internal laryngeal nerve. And what internal laryngeal nerve is doing? This is the one. देखो, दो क्वेश्चन है यहाँ पर. एक तो बेटा इंटरनल लैरिंजियल नर्व अंदर पहुंचा कैसे? इंटरनल लैरिंजियल नर्व इट पियर्सेस व्हाट मेम्ब्रेन? थायराइड मेम्ब्रेन. और जैसे ही थायराइड मेम्ब्रेन को पियर्स करेगा, आफ्टर पियर्सिंग थायराइड मेम्ब्रेन, द नर्व विल बी रनिंग थ्रू द पायरिफॉर्म फोसा. It will running through the floor of pyriform fossa. So एक क्वेश्चन पूछते हुए, स्मगलर्स पाउच, pyriform fossa, a fish bone will get stuck into the pyriform fossa. तो कौन सी nerve injured हो सकती है while removing it? That is internal laryngeal nerve. It is running in the pyriform fossa. And after that, the nerve is basically going to supply the mucosa. It supplies the mucosa of larynx where? Above vocal cord. Vocal cord के ऊपर supply कर रहा है. It is supplying the sensory nerve. It is supplying the mucosa of the larynx above vocal cord. So that's the story about the superior laryngeal nerve. Superior laryngeal nerve की दो branches आपको दिख रही हैं. External laryngeal nerve is a motor branch which is supplying the cricothyroid muscle, purely motor है. And the another branch here is the nerve which is piercing thyroid membrane, passing through the pyriform fossa, and that is the sensory nerve supplying the mucosa of larynx above vocal cord. तो एक मसल सप्लाई कर दिया हमने और mucosa above the vocal cord हो गया. अब बाकी बचा क्या? There is another branch of vagus nerve. There is yet another branch of vagus nerve which will actually come back. And this nerve, I hope you know that nerve is called as a recurrent laryngeal nerve. Because the nerve goes below the artery and come back, that is a recurrent laryngeal nerve. Recurrent laryngeal nerve का job is to supply whatever is left. जो भी बच गया, everything is by recurrent laryngeal nerve. Okay? So recurrent laryngeal nerve is the one which is, first of all, it is going to supply the म्यूकोसा बिलो वोकल कॉर्ड. एक तो पहला ये हो गया कि इट इज गोइंग टू सप्लाई द म्यूकोसा बिलो वोकल कॉर्ड. नंबर 2, it is going to supply all muscles of larynx. It supplies all muscles of larynx except which one? Except जो already हम supply कर चुके हैं, that is cricothyroid. It is going to supply all muscles of larynx except cricothyroid. And it is also going to supply one muscle of pharynx also, guys. I hope you read about that muscle in the Killian's dehiscens or Zenker's diverticulum. That muscle is the cricopharyngeus. Cricopharyngeus, guys. Cricopharyngeus is a muscle which is a part of inferior constrictor. It's a part of inferior constrictor. This is what the recurrent laryngeal nerve is all about, guys. So it supplies the mucosa below the vocal cord. ये sensory part हो गया इसका. It is supplying muscles of larynx, all muscles of larynx, एक cricothyroid को छोड़ के, and it is also supplying one larynx muscle, pharynx muscle also, that is the cricopharyngeus, which is a part of inferior constrictor. So again, the question asked to you in the exam was about the nerve supplying the larynx above vocal cord. Now I should know about the superior laryngeal nerve and recurrent laryngeal nerve. आपसे जो भी पूछे, you should be able to answer it here. Superior laryngeal nerve, external laryngeal nerve supplies cricothyroid, internal laryngeal nerve supplies mucosa above the vocal cord, और बाकी जो सब कुछ बच गया, everything left is all done by the recurrent laryngeal nerve. Mucosa below the vocal cord, all other muscles of larynx, and even one muscle of pharynx also. That is done by this. Right, so guys, this is about the laryngeal innervation. चलिए वापस आते हैं फिर से. Let's again go back to the part. So we have talked about this laryngeal muscle innervation also. There's a question which is an osteology question about the mandible. So I'll tell you about that here, and then we'll have a quick discussion on the dural venous sinus to finish off the HNF part here, guys. तो पहले तो जरा इस image को लेते हैं. There's a question on this. This basically is a question about कि what third molar remove कर रहे हैं and the nerve is injured close to that what is the nerve injured and what will be the consequences in that case. So सबसे पहले ना just have a look at this picture. What you see here is the mandible और एक foramen में mark किया हुआ, guys. That foramen is the mandibular foramen, right? That foramen is a mandibular foramen. देखो mandibular nerve कि एंटीरियर डिवीजन से और पोस्टीरियर डिवीजन दो अलग अलग नर्व आ रही है. देयर इज अ नर्व कमिंग फ्रॉम द सो कॉल्ड पोस्टीरियर डिवीजन ऑफ द मैंडिबुलर नर्व. नाउ पोस्टीरियर डिवीजन ऑफ मैंडिबुलर नर्व से एक ब्रांच तो आता है विच गोज इनसाइड द मैंडिबल. ये मैंडिबुलर फोरामेन के अंदर एंटर करके लुक एट दैट नर्व. देन दिस नर्व इट रन्स इनसाइड द मैंडिबल. ये मैंडिबल के कैनाल के अंदर रन करेगा एंड अल्टीमेटली विल कम आउट फ्रॉम द मेंटल फोरामेन. आपको ये फोरामेन दिख रहा है बाहर की तरफ, मेंटल फोरामेन ये वाला. इट विल कम आउट ऑफ द मेंटल फोरामेन. मैं उस साइड पे ड्रॉ करता हूँ. That nerve will be then called as a mental nerve. सबसे पहले what nerve is it, guys? This nerve which is entering inside, it is an inferior alveolar nerve. Inferior alveolar nerve. Now नाम से एक चीज क्लियर है कि नाम ही inferior alveolar nerve. So this nerve responsibility is to supply the lower gums and teeth. ये जो भी आपको molars, premolars, जितने भी आपको lower jaw के teeth दिखाई दे रहे हैं, and the gums they are supplied by inferior alveolar nerve. And ultimately the nerve comes out as the mental nerve. एक बार बाहर आ जाएगा मेंटल नर्व तो इट सप्लाइज द स्किन ऑफ द चेन एरिया. सो इंफीरियर एल्वुलर नर्व और उसी की कॉन्टिन्यूशन क्या है, दैट इज अ मेंटल नर्व दैट यू लुकिंग एट, राइट. नाउ डेंटिस्ट व्हेन दे आर डूइंग एनी सर्जिकल प्रोसीजर ऑन द लोअर जॉ, उनको कौन सी नर्व एनेस्थेटाइज करनी है? इंफीरियर एल्वुलर. ऑब्वियसली इंफीरियर एल्वुलर नर्व को एनेस्थेटाइज करेंगे तभी आपके लोअर जॉ के जो टीथ हैं वो एनेस्थेटाइज होंगे, वहां पर दो गम्स एनेस्थेटाइज होंगे उस केस में. सो द इंटेंशन ऑफ द डेंटिस्ट इज बेसिकली टू इंजेक्ट the inferior alveolar nerve, but there is another nerve which is running very close to the third molar, and that is another branch of the mandibular nerve, guys. That nerve is the lingual nerve. The lingual nerve, which is again a branch of mandibular nerve, is also is very close to that here. So एक तो ये ध्यान रखना कि दोनों mandibular nerve की branch है, guys. Whether it is the inferior alveolar nerve or it is the lingual nerve, both are the branches of mandibular nerve only. दोनों mandibular nerve की branches हैं, but दोनों nerve के job अलग हैं. Inferior alveolar nerve is supplying the lower gums and teeth and coming out the sensory branch called as mental nerve. जबकि lingual nerve, obviously we discussed already, guys. Lingual nerve is already joined by chordate and penny. So lingual nerve is carrying the sensation from anterior 2/3 of tongue. So what happens is कि while trying to inject the inferior alveolar nerve, अगर आप accidentally inject कर देते हो कि इसमें lingual nerve के अंदर, तो patient will have what? सेंसरी लॉस इन द एंटीरियर 2/3 ऑफ टंग. जनरल सेंसेशन भी जाएगा और टेस्ट सेंसेशन भी जाएगा बिकॉज बोथ आर कैरिड बाय द लिंगुअल नर्व इन दिस पर्टिकुलर एरिया. सो that's the question here, that कौन सी ओरिजिनल नर्व है, that is inferior alveolar which need to be anesthetized, and which is accidentally anesthetized sometime is what nerve, that is the lingual nerve. That is the question here. So if I may take you back to the question, guys, the question कुछ ऐसा बोल रहा है. A 42-year-old female who had an extraction of the third molar teeth reported loss of sensation on the anterior 2/3 of tongue and the floor of mouth. Which nerve is most likely damaged? So obviously extraction of teeth कराया, ठीक है. Maybe before the extraction, the nerve which was anesthetized obviously was the inferior alveolar nerve. But extraction के time में the nerve जो damage हो सकता है because the nerve is very close to the third molar is the lingual nerve. So the answer to this particular question is the lingual nerve, which is a branch of mandibular nerve. Okay, and finally coming to this couple of more question, guys, there is a question. One question is about the relations of the cavernous sinus, which is very very important. और एक vein of Galen पे, क्योंकि I've seen this question asked in the recent times, so I should tell you about the vein of Galen and also about a little about the dural venous sinus in that area. So मैं ये दो images को use करता हूँ यहाँ पे. Let me just use these two images here and let me explain you a little about that as well. I need to add a page. Just one second. Okay. देखो, the first image which I have kept here for you is to show you the different dural venous sinuses and what is the direction of the blood flow. इसमें हमारे इस क्वेश्चन का आंसर भी आ जाएगा. देखो, you're looking at dural folds, guys. I hope you people have read about the dural folds, falx cerebri, falx cerebelli. शिवांगी बेटा, nerve supply to the upper jaw. Upper jaw के लिए जो nerve है उसको, that is a maxillary nerve supplying the upper jaw. Maxillary nerve के different branches होती हैं. We have a posterior superior alveolar, middle superior alveolar, anterior superior alveolar. सब superior alveolar nerves are supplying the upper jaw, जो किसकी branch है? Maxillary nerve here. Lower jaw is by mandibular nerve and upper jaw is by the maxillary nerve branches. Okay, so coming to this, the dural fold, guys, this dural fold here that you're looking at is a falx cerebri. नीचे ऐसे एक यहाँ पे falx cerebelli होता है, tentorium cerebelli. Like we're not discussing dural fold, we're looking at the dural venous sinuses. देखो, look at this dural venous sinus जो कि blood को पीछे की तरफ लेके जाएगा like this. The direction is important and here's another one here. Now this dural venous sinus जो आपको ऊपर दिखाई दे रहा है along the upper margin, this is called as a superior sagittal sinus. It's running in the sagittal plane, that is a superior sagittal sinus. And there is another sinus which is running in the lower margin of the falx cerebri called as the inferior sagittal sinus. Superior sagittal, inferior sagittal, और दोनों superior and inferior sagittal sinus जो blood को लेकर जा रहे थे, taking the blood backwards and downward, दोनों नीचे और पीछे तरफ लेकर आ रहे हैं. Then you can see, especially the inferior sagittal sinus will continue its journey and drain the blood into this sinus here, which is called as a straight sinus. This sinus here is called as a straight sinus. एक sinus आपको नीचे से ऊपर भी दिख रहा है, guys, the sinus which is taking the blood upward here like this here, that sinus is called as a occipital sinus. It's coming from the occipital bone area, तो नाम ही रख दिया occipital sinus. And now look at this कि superior sagittal, inferior sagittal, straight sinus, occipital sinus, ultimately इन सबका blood यहाँ पर पहुँच रहा है at this common point. The blood is reaching this common point and this common point is called as a confluence of sinuses. That's a meeting point of sinuses, or you can say confluence of sinuses. The confluence, meeting point. Once the blood reaches the confluence of sinus, अब हमें करना क्या है? इस blood को बाहर निकालना है. We have to take this blood out of the cranial cavity. Now from the confluence, the entire blood from the confluence is running into this sinus, which is running in the transverse manner. So that's why the sinus is called as a transverse sinus, guys. I'm just trying to write them meticulously. This is a transverse sinus. It's running in the transverse sulcus, तो नाम ही है transverse sinus. और ultimately transverse sinus से जो blood है वो ultimately goes into this one, that is called as a sigmoid sinus. और ये sigmoid sinus ही है जो blood को बाहर लेकर जाएगा. It's a sigma shaped sinus called as sigmoid sinus. And it's the sigmoid sinus which ultimately will continue below into the internal jugular vein, or I can say it is going to form the internal jugular vein. जो internal jugular vein में blood लेके नीचे जाएगा, that is the sigmoid sinus itself, right? That's one thing. It is a direction of the blood flow. Superior inferior striatal sinus blood को पीछे लेके गए. Straight sinus also goes backward. Occipital sinus नीचे से ऊपर की तरफ आया. Come to the confluence. From the confluence the blood goes into the transverse. Transverse सर किस में आया? Sigmoid में. और sigmoid is the one which will continue into the internal jugular vein के अंदर चला गया. क्वेश्चन हमसे जो पूछा हुआ, अब ये तो हुआ डायरेक्शन ऑफ द ब्लड फ्लो. जो क्वेश्चन पूछा हुआ है कि वेन ऑफ गैलन कौन सा साइनस में जाता है. गाइस, इफ मैं एक बार इस पिक्चर एनलार्ज करता हूँ, कैन यू सी अ वेन ओवर देयर? लुक एट दैट वेन. इट्स अ वेन कमिंग फ्रॉम द ब्रेन, जिसको हम बोलते हैं वेन ऑफ गैलन. वी ऑल्सो कॉल इट अ ग्रेट सेरेब्रल वेन. वेन ऑफ गैलन और ग्रेट सेरेब्रल वेन. एंड इट इज वेरी क्लियर फ्रॉम द पिक्चर दैट वेन ऑफ गैलन is going to drain the blood into what sinus? Into the straight sinus. So that is the answer to that question. कि vein of Galen जो brain से आएगा, जिसको हम great cerebral vein भी बोलते हैं, that is the one which is carrying the blood into what sinus? Straight sinus. The straight sinus के अंदर blood में लाके pour करेगा. Exactly, guys. That is, yeah, you all know that. So that is about a little about the dural venous sinus and the direction of the blood flow. अभी इसी picture के अंदर मैं आपको एक चीज दिखाता हूँ, then I'll discuss it separately with you guys. Can you see in the middle cranial fossa there is a sinus present here? और ये sinus पीछे communicate भी कर रहा है. This sinus is a cavernous sinus. Let me discuss the cavernous sinus separately with you, but just to tell you that cavernous sinus is present here in this picture. That is a cavernous sinus. And you can see cavernous sinus, whatever blood comes into cavernous sinus, वो पीछे की तरफ जा रहा है. There are two major sinuses, superior petrosal, inferior petrosal sinus, which जो पीछे की तरफ blood लेके जा रहे हैं cavernous sinus से. But what is the question actually asked on the cavernous sinus mainly is the relation. Cavernous sinus का अगर आप coronal section ले, if you take a coronal section of cavernous sinus, what are the relations that you will see in the cavernous sinus and why those relations are important? That is also important. Look, if you look at this next image, that is to show you this only. It's a coronal section through the cavernous sinus. See, this whole sinus here is a cavernous sinus. Let me just give you a little orientation about this picture, guys. This bone here is a sphenoid bone. So first, if I look at the cavernous sinus medial relation, let me एक साइड पे राइट करता हूँ. This is a sphenoidal air sinus. Sphenoidal sinus. Just above the sphenoidal air sinus, you can see there is a sella turcica, and in the sella turcica, you can see pituitary gland is present. So sphenoidal air sinus, sella turcica, pituitary gland आपको दिखाई दे रहा है. So these are the medial relations of cavernous sinus. ये दोनों structures जो हैं, remember they are going to form the medial relations of cavernous sinus. यहाँ पर हमारा point ही है cavernous sinus के relation discuss करना. We're talking about the relations of cavernous sinus, and that is a medial relation, pituitary gland, sphenoidal air sinus. Lateral relation of cavernous sinus, guys. There are 4 nerves which are running in the lateral wall of cavernous sinus. 4 nerve lateral wall के अंदर है और 1 nerve cavernous sinus के अंदर present है. Now what are the nerves present in the lateral wall of cavernous sinus, which is marked as A, B, D, and there is another nerve which is shown below. So let me just point out carefully. These are the nerves shown in the lateral wall of cavernous sinus. So in the sequence, that is the 3rd nerve, 4th nerve, ophthalmic, and maxillary. These are the 4 nerves, guys. 3rd nerve, 4th nerve, ophthalmic, and maxillary. These 4 nerves are located in the lateral wall of cavernous sinus. These 4 nerves are present in the lateral wall of cavernous sinus. Yeah, that is 3rd nerve, 4th nerve, ophthalmic, and maxillary. Exactly. And the only nerve which is marked as C, guys, the only nerve which is marked as C, मैं इसको अलग से यहाँ पे mark कर लेता हूँ. The one which is marked as C, let me point out these two structures separately here. That is the internal carotid artery. Along with that, C is what nerve? That is the 6th nerve, abducens nerve. These two structures, internal carotid artery and 6th nerve, they both are located inside cavernous sinus. वो अंदर की तरफ present है, guys. They are both present inside the cavernous sinus. रंजन बेटा 3, 4, 5 मत बोलो, because 5 में तो फिर तीनों आ जाएंगे ना, ophthalmic, maxillary, mandibular. Mandibular is not there in the lateral wall. So it's the 2 part of the fifth की 2 part, V1 and V2. Ophthalmic and maxillary is there. Mandibular nerve is not there in the relation. Mandibular nerve cavernous sinus relation में ही नहीं है. Forget about lateral or medial. ठीक है. So internal carotid artery आपको अंदर दिख रहा है, and the nerve present inside is the 6th nerve. देखो, that is important to know because Sixth nerve is the nerve which is inside cavernous sinus. So अगर आपसे क्वेश्चन पूछते हैं कि a patient is having a cavernous sinus thrombosis, then which nerve is most likely to get affected? तो सबसे पहले तो obviously कौन से nerve affect होगा? Sixth nerve. Sixth nerve, abducens nerve, is most likely to get affected in the cavernous sinus thrombosis. Yes, there could be the third nerve involvement, fourth nerve involvement, but if the question is about the most common nerve to get affected in the cavernous sinus thrombosis, then obviously the nerve running inside cavernous sinus, and that is what nerve? That is the sixth nerve or the abducens nerve. Sixth or the abducens nerve for that. Exactly. Komal, you are absolutely right. It is inferior lateral to the internal carotid artery. The proper relation is inferior or lateral to the internal carotid artery. That is correct here. What is above cavernous sinus? Cavernous sinus के ऊपर आप देखेंगे तो आपको मेनली क्या मिलेगा? ऑप्टिक chiasma. Optic chiasma and once again internal carotid artery. Guys, the same internal carotid artery ये घूम के ऊपर चला जाएगा. The internal carotid artery will from the cavernous sinus, it makes a turn and goes above the cavernous sinus also, although not shown in this picture, but both optic chiasma and internal carotid artery will be seen in the roof of the cavernous sinus as well. तो ये main relation है यहाँ पे guys. देखो medial side में we have pituitary gland, sphenoidal sinus. Lateral में you can see there is a third, fourth, fifth nerve and ophthalmic and maxillary nerve. Sixth nerve अंदर दिखाई देगा along with the internal carotid artery, and same internal carotid artery आपको ऊपर भी दिखाई देगा. And there is one interesting fact here कि because internal carotid artery, you are able to see the internal carotid artery inside cavernous sinus. So कई बार क्या होता है? Let's say if there is an aneurysm of internal carotid artery and there ruptures. If there is aneurysm rupture of internal carotid artery inside cavernous sinus, अब इससे क्या होगा कि when the aneurysm ruptures inside the cavernous sinus, there is a formation of something called as a cavernous fistula. There is a formation of the cavernous fistula, guys. Your internal carotid artery is directly communicating with cavernous sinus. But अगर ये rupture ही हो गया, if the wall of the internal carotid ruptures, so obviously internal carotid artery is now communicating with cavernous sinus. Now what will happen when internal carotid artery will pulsate? The whole cavernous sinus will pulsate. Or anterior relation of cavernous sinus is the superior orbital fissure. Cavernous sinus बिल्कुल superior orbital fissure के पीछे होता है. So that's why when cavernous sinus is going to pulsate, it is going to push the content of the orbit also, and that is going to cause the pulsatile proptosis. Pulsatile proptosis. So one of the outcome of if the internal carotid artery inside cavernous sinus ruptures, that is a formation of the cavernous fistula, and that can lead to the pulsatile proptosis. You will see the pulsating eyeball will be seen. That is a pulsatile proptosis because the cavernous sinus is pulsating and it is also pushing the content of the orbit as well. Exactly, Ranjan. Correct. Right. So guys, this is a little about the discussion on the topics which were asked in the recent time. And before we take a break or something, just let me एक बार दोबारा सबके सामने रखता हूँ. Again, guys, I tell you that as I told you that you will be having another session after mine that is about the question discussion. So you will be discussing those questions in that part here. My job is to just make you look around those areas from where the questions are being asked, and if there is something beyond asked on that topic, or if there is a twist in the language of the question, you should be able to manage it here, right? Head and neck, bada unit hai guys. Head and neck, obviously, you have a question integrated with ophthalmology, you have a question integrated with the ENT part as well. So you got to be reading that area as well. But these are the questions 2019 के बाद से ये वाले कुछ questions जो कि head and neck से आए, and I think that I would love to believe that इसमें से बहुत सारे question like muscle of mastication है, Tyrion है, facial palsy है, these questions are lingual nerve injury, these questions ये repeat होते रहते हैं sir. Every year, alternate year, they will keep asking the question on this year. The only thing you need to be smart enough to identify कि इस question में difference क्या है, what is a change in the language or the image, and you still should be able to answer all of them. Right. So guys, with that note, let's take our first break. हम इसको break में discuss करेंगे पूरा. Right. We cannot. So let's take a break of around 20 minutes or so. 20 minutes के बाद दोबारा मिलते हैं. Next in the next video, we'll be focusing mainly on the neuroanatomy and we'll be talking about the embryology also. Like हम next video में neuroanatomy and embryology के बारे में discussion करेंगे. So I'll catch you after the break. And do let me know that if you're finding this session helpful, if it is helping you to revise the topic which are asked in the recent time here. Right? I'll see you in 20 minutes from now in the next video.